Good afternoon, and thanks for joining us for today's Healthline 3. I'm Courtney Butts, and today, or this month, April, is Autism Awareness Month. And joining us today to talk about this is Michael Smith with Brentwood Hospital. So thanks for being here, Michael.
Thank you for having me. I appreciate it.
Yes, so Brentwood Hospital is local here in Shreveport, and there's a lot of things that Brentwood offers, but specifically for autism, tell us what Brentwood offers for those.
So, on August 14th of 2023, we opened the first ever ASD special unit in the area, and really very few nationwide.
Wow.
And the reason why we opened that unit is research shows that children and adolescents with autism often end up in inpatient care at a higher rate than other children. And what happens when that happens is, I don't know what you know about acute care, but Brentwood's an acute care hospital, which means it's kind of like an emergency room for crisis, right? And so people come to us when they feel like they can't cope, and our job is to help them get stabilized and to work with outpatient community resources to get them set up for continued care as they work through whatever issues they're coming to us with, whether it's trauma or suicidal ideation or just anything along those lines. And so what research also shows is that because kids with ASD or autism spectrum disorder end up in hospital settings so frequently, that because of what a hospital like that does specifically, their ASD diagnosis is considered a secondary diagnosis. So they may come with trauma, loss of a loved one, suicidal ideation, homicidal ideation, which is aggression, and that ASD diagnosis had to kind of be overlooked. They went on to units with other children like them, neurotypical, what we would call normal, I think. I don't believe there's any such thing as normal, so I use the term neurotypical. And what research showed was that the quality of care that these kids were getting was not everything it could be. Because kids with ASD, they have communication barriers. Anything from I don't speak at all because it's uncomfortable for me, or I can't, to just problems relating socially to others, not being able to pick up on social cues or nonverbal behaviors of others. They have a hard time reading that. And so the therapeutic approach that we take at Brentwood is a group approach. So these individuals go to groups and they talk about their feelings, and they talk about ways that they can perhaps respond differently to the circumstances and the problems that they're facing outside of the hospital than the way they have before coming in. And it was very difficult for these patients with ASD to engage in those types of conversations. And so they weren't benefiting from all of that care. And so on the ASD unit, we use applied behavior analysis to kind of do a functional assessment of what their barriers are, a functional assessment to figure out what's the cause of this problem behavior that they're exhibiting and why are they with us. You know, what's their motivation, what's reinforcing that behavior, and we work with the family as well. We do training with the parents or the guardians of these children, but we also then take a very systematic approach to teaching new behaviors and new skills with those barriers in mind that help them address the problems that they're facing outside of the hospital with better and clearer understanding based on who they are as individuals.
I love that. Yeah, and I love that you're addressing this need, this great need that we have in our community. And so you are currently working at Brentwood Hospital. So tell me a little bit about your role at Brentwood.
So I'm a board behavior analyst, and so part of what I do is those functional assessments. I work directly with the children. We've added staff over the year, and we have a new associate behavior analyst, and we're adding registered behavioral techs to kind of help work with these kiddos. And so I'm the program manager for the ASD specialty unit, and we've seen growth. We've seen the community's responsiveness to this need to be very positive. And so later this year, hopefully very soon, we're going to be opening our second ASD unit for adolescents.
Nice. So right now you're working mostly with the kids, the
I work
young
with
children.
the kids and supervise the staff, and work with medical staff and their nursing staff as a part of a treatment team to address all of the needs that these children face when they come into the hospital.
Gotcha. Wow. And it just sounds like it's a cohesive approach, and you have to have that when you're dealing with this diagnosis.
Absolutely.
Yeah. So tell us a little bit, for maybe those that don't understand autism fully, or ASD, the spectrum, the levels of it. Can you just define it quickly for us?
Absolutely. So autism spectrum disorder, or autism, it is a disorder. A lot of times we think of it as an intellectual disability, and in the most technical terms, it's not necessarily an intellectual disability. Children with autism have a different way of perceiving and learning based on the barriers that they face. And but they still have the potential to learn. Whereas with intellectual disability, based on their IQ, there's some speculation and some kind of understanding of how far can we go with these kiddos. But with ASD, I never want to see us limit any of the potential, because they can learn. And so what autism spectrum disorder is there are barriers based on two major sets of deficits that kids with autism face. One is communication barriers. Like I've said before, that can be anywhere from having really poor social skills, not being able to interpret facial expressions and nonverbals, to being completely nonverbal. And so that's one area. And then the other area is repetitive behavior. And so when we think about repetitive behavior and autism, we often think of the most extreme, the hand flapping, the repetitive verbal behavior. But really, it's a proclivity towards repetitive behavior of any sort that kind of helps regulate that emotional overload, that sensory overload. And so it could be tapping, it could be lining items up in a row, it could be this obsessive compulsive need for a certain kind of order with certain things. And so when we talk about autism being on a spectrum, those barriers in those two primary areas exhibit in different levels in different ways. And some of the barriers are more intense with some kids than they are with others. So we see it as a spectrum disorder, and we label kind of where you are in that range, mid-range being a level 2, the upper end being level 1, and the lower end would be level 3. And kind of based on where you are, that gives us a beginning place to kind of begin to see what's going to be the best therapeutic approach for you, what's going to be the best way to teach, what's going to be the best way to even communicate.
Yeah, and I like that you mentioned that it's more to do with like the social skills and the way that they communicate versus the intellectual ability.
Yeah,
I think that's a
absolutely.
misconception a lot of times when people don't understand ASD fully, and so that's a good distinction. Yeah.
So when we talk about opening the adolescent unit, what we're seeing a lot of, along the lines of what you're talking about, is a lot of our kiddos that we've seen that end up in the hospital who are adolescents, maybe they had a lot of barriers at some point when they were younger, but they adapted, and a lot of those kids may be in regular classes at school, they may be functioning, it appears, really well. But the reality is they have that same sense of sensory overload that they've always had. They've just learned how to kind of hide it. We call that masking. And that masking, that kind of observing the environment around you, adapting your behavior to look more like what is socially acceptable, creates a tremendous amount of pressure. They're creating a tremendous amount of pressure on themselves. And so they get into this habit of masking feelings, anxieties, the overstimulation. They spend a lot of time thinking about how am I going to respond in this social setting or whatever. And when the pressure of that builds to a point, they have a kind of a breakdown of sorts. They just get to the place where they can't emotionally handle it anymore. And so part of the reason we want to open this adolescent unit is we want those kids to come into a hospital setting that understands, has a unique understanding to the pressures that they're feeling, the anxiety that comes with being who they are, and helping them embrace who they are and learn when to say stop, learn when to say, no, I can't do that right now. And so that's the significance, I think, of treating older kids with ASD. It's not always the kid that you look at and say, that child has ASD. A lot of times it's the child you may look at and never suspect who really needs some of that therapeutic help.
Yeah, well, looking forward to that opening. I know that you're going to help a lot of kids, especially adolescence, just a hard age.
It's just tough, period.
Yeah. Okay, well, if you're just joining us and you have a question specific, we're talking about autism spectrum disorder. It is Autism Awareness Month, and we're talking with Michael Smith with Brentwood Hospital. Those phone lines are open. It's right there on your screen, 318-219-4569. If you do have a question, give us a call. And, when we're talking about, sometimes it's masked and we don't really know, if a child has, autism, and let's say, there's a parent and they're worried about their child having autism and they want them to seek help. What are those warning signs and maybe those less obvious warning signs?
Well, I think today we've become a lot better. Our pediatricians are a great place to start in seeing that child is maybe not on track with some of the developmental milestones, which is something that your pediatrician's looking for already, right? Those milestones tell us about your child's health. If you're seeing a delay in speech, if you're seeing frequent kind of anxiety-based tantruming, if you're recognizing a lot of ritualistic behaviors for younger children, for instance, we mentioned lining things up. If Tommy has a wide variety of action figures in different colors and shapes and from different genres, right? If you notice that he is lining those up in some kind of specific pattern that only makes sense to him, and if you move something and he gets really upset, that's a rigid behavior that you might want to look into. And you can begin to notice those things as early as 2 to 3, right? Most 2-year-olds are beginning to develop verbal speech. If your child is not, go ahead and talk to your doctor about how do I get some screening done for the possibility of ASD. If you have family members or the child has a sibling who has autism, that can be an indicator that that's something you need to be looking for. If there were complications during pregnancy, if a family had a child later in life, those are all factors that could lend themselves to at least the need to be aware that this is a potential. And then the biggest thing I would say to any parent is not to be afraid of that diagnosis. The earlier you can get a sense of where my child is, the earlier you can get that diagnosis, statistically, the better chances are that child is going to be able to get the support that they need. It's not that they can't learn, it's that they learn differently, right? It's not that they don't have emotions, it's that they need to know how to access those. And so getting that diagnosis is not necessarily in any kind of way derogatory for your child's future. You want to know as soon as possible.
Right, and then that way you could, the parents can learn the different ways that they communicate and the way they process emotions, and that it just helps them in the future.
Absolutely.
Yeah. Okay. Very interesting. So how you mentioned, getting that diagnosis or that screening. Can you talk about that process?
So a lot of times your pediatrician can do an initial screening, and then they're going to hopefully be able to recommend you to a psychologist or a psychiatrist in the area that will do a full screening. When kids come to Brentwood who we suspect have ASD, we do a screening and an initial assessment that for our sake, so that we know how, as a treatment team, how to best deal with their issues. But for instance, for applied behavior analysis to get in with ABA, those clinics may want a full workup. And a psychologist or a psychiatrist can do that for you. Your doctor should know of individuals in the area who can do that.
So the big point here is, start with your pediatrician.
Right.
They probably have already seen some of those signs, and then they're the best kind of gateway to show you what's next.
Absolutely.
Yeah. Okay. So we've talked a lot about, parents and what parents should do. So I know you have some book recommendations. I'll let you get that pulled up
read these to
really
you
quickly.
real
But if
quick.
you're just joining us, you can give us a call at 318-219-4569 if you have a question.
So there are 3 books that I recommend to every family that comes into our program. The first is 10 Things Every Child with Autism Wishes You Knew. It's the 3rd edition, and it's by Helen Notham. And it's just great because it's written from the perspective of that autistic child. And there are things that they wish people understood about kind of where they are. The other is Positive Parenting for Autism by Victoria Boone. And it provides just a lot of strategies and helps for the family just in terms of day-to-day life and how to parent a child, how to help them deal with bullying or any of those factors that any kid might face today, but just from the perspective of autism. And then probably my favorite is Uniquely Human, and it's a different way of seeing autism than the way a lot of times culturally we view them. Mostly not negatively, but just from a lack of understanding.
Right.
And it really celebrates the differences that are unique and special to kids with ASD. And so in my program, I always try to emphasize, and as a staff, we try to emphasize what's the positive side of this diagnosis? What comes with autism that is special and unique to you, that can be celebrated by family and loved ones, and even encouraged. And there are definitely some attributes. Tenacity, stick-to-itiveness, right? Being so hyper-focused sometimes on subjects and topics that are of interest to them that they're relentless in learning more and really becoming experts in those areas.
I love that.
Yeah.
That's pretty cool. Well, we have our first caller, Pat.
Okay.
Thanks for joining us, and what is your question?
Yes, I am a certified state child care provider, and I normally get children at a very, very young age. And I have had several of them that have had the autism syndrome, and one of them passed away. I learned about it in my last class there at Northwestern. Have you all partnered with Northwestern in order to give us some tools that we could work with? We normally have workshops, and I'd like to for others to know about it that's caring for children, because we get them at infants, and those are things that we can be looking out for.
Absolutely. So we've not partnered with Northwestern at this point. I'm glad that you brought that up. Generally, I like to partner with anyone who's a part of the community of support for kids with ASD. LSUS has a applied behavior analysis program, so that might be one resource that you could reach out to. Certainly you could call the hospital and ask to talk to me, and we would love to sponsor and help offer some support, because the more we educate the community on what these needs are specifically, and it is educators and child care providers and families. It's those people that are directly dealing with them who need the most resource, right?
Absolutely, absolutely. Because we see them and we notice things that are delayed because we've got this chart where we're not actually pinpointing them that they have to reach this milestone, but we know that there's a parameter.
Absolutely.
And but we have seminars that we go to for classes like 3 hours on weekends and that type of thing.
Yeah.
So I'm going to reach out to you and see if I can get some data, and I will be able to talk with some of our advisors there at Northwestern and see if we can just do a seminar for us. It doesn't have. It could be a virtual or just whatever. But
Absolutely.
it was just so informing to hear you on there talking about it, and I just wanted more of the providers to know about it.
I would love to do that, and so please do reach out. And just let me encourage you, continue to be communicative with the families when you see these deficits. Don't be afraid to, doesn't sound like you are, but don't hesitate to say, hey, these are some things that we're noticing. Why don't you talk to your pediatrician? Let's be proactive and not reactive. Let's not wait until the problem becomes so large. Let's try to get ahead of it. I think you're in a great position to really help families with that.
Yeah.
Well, I thank you for taking my question.
You're welcome.
And do you have that number for the hospital?
The hospital number.
Or where they can get best.
I'm going to let me look it up for you real quick. I should know that right off the top of my head, but I don't call myself.
Right, yeah. So that way, Pat, if you're still tuning in, you can write down this number. I'm sure you could find it online as well. Brentwood Hospital in Shreveport, and Google's our best friend these days. So I'm sure we could find it that way too. But that way we have it, and if anybody else is tuning in and they want to reach out and see about partnering as well.
So that phone number is 318-678-7500. And if you call that number, you'll get to the switchboard and just tell them that you would like to talk to Michael Smith, the Autism Special Unit Program Manager.
Perfect. All right. Well, thanks, Pat, again for joining us. And if you have a question, Larry, thanks for joining us. And what is your question?
Hi, Larry.
Hey, this is Larry. I'm out here in Northeast Texas. We don't have much help for autism, but I got a niece coming in from Iowa that they seem to think that we can get her better help down here.
Okay.
She just went to a program out in Arkansas, so we're trying to find a local program here or some support that we can help her out with. And she's just turning 16.
Okay.
She's going through some things in her life, but she went through a lot of trauma from 10 to 14, and we sent her to a treatment center out there in Arkansas.
Yeah.
And she's doing really good, but we don't want her to return to her atmosphere. We want her to go ahead and graduate school and help her out. And how do we go about that?
So where are you at exactly in North Texas?
We are probably about 30 minutes outside of Gladewater.
Okay.
Up north. We're between Longview and oh shoot, you got me stirred up there. Between 20 and 30, Highway 20 and 30, out there by Lake of the Pines.
So you may reach out to an ABA clinic, and there's several in that area called Behavioral Innovations, and they offer ABA, obviously not inpatient, but it's outpatient, but it's in the clinic. But they offer also some after-school programs that may be really helpful, that work with social skills and some of those kind of factors. And being 16, that social aspect of life is very important and stressful for all teens, but it can be particularly stressful for an adolescent with ASD as well. Did she have any ABA therapy when she was younger?
She just come out of the school. There was a treatment, and she's graduated pretty high, but we're feared that back in Iowa she's going to come out and return to the atmosphere she's in because she's getting a lot of peer pressure from school.
Yeah. So
and they know her background, so she's struggling right now.
She's probably level 1 on the higher end if she's doing, if she did well academically, pretty well academically in school, and and is pretty communicative. Another thing that I would suggest is if she's struggling some, just look for just a good talk therapist in the area who is willing to just take into consideration the fact that ASD is also a part of what this young lady is facing. And just finding a therapist, a talk therapist, who is willing to allow her to kind of talk about what it feels like to have ASD, talk about, her feelings of how it's different, how she feels different than others. That can be something that's really powerful for someone at 16.
Okay. Well, I'd look for any information or hotlines I can get a hold of, because we want her to graduate. Finish the graduation program.
Absolutely. And so is she going to go to school there in Texas?
Well, we're looking for a private school. If not, we're going to do homeschool.
Okay.
And we didn't know which one would further harm her, and we was hoping to do homeschool. Her aunt is my wife is she's a disability teacher herself down here in the Longview School District.
Okay.
And so we're digging every route we can to up here to northeast Texas. My wife drives about 28 miles to school.
Yeah.
It was kind of looking something more convenient for her, because she's going to be in a new atmosphere, and we want her to be comfortable in it.
So a lot of kids with ASD, a lot of families do choose to homeschool because of the sensory overload that is so pervasive for these kiddos. And so that homeschool setting kind of allows some self-paced work, the ability to say, I have too much, this is too much right now, I need a break. And then, so my recommendation to you would be that if you do that, also be proactive about thinking about ways that you can help her have socialization with peers her own age. But it can be done.
Yes, sir. Okay.
Yeah.
Good deal. Like I say, I'm a military guy. I'm a veteran, so I fight post-traumatic stress syndrome. So I kind of relate, so I'm always out to help the community.
Appreciate you.
That's where I'm at now.
Thank you for your service.
Yeah. Thanks for your service,
I appreciate
and thanks
that.
for joining us, Larry. Thanks for your
Yes,
question.
ma'am. You guys have a blessed day.
You too.
Thanks. Yeah, we have just a couple minutes left, and so kind of piecing the two together, April, autism awareness, May's mental health awareness.
Right.
So how do you see both? Do you see a lot of mental health issues maybe with these kids?
Well, you do, actually, and it's hard, sometimes when an autistic child speaks of suicidal ideation, it could be that they don't really know how to communicate and express what's really going on with them, and it gets an immediate response, because that's something we have to take seriously, right? And so we definitely see a lot of what we would call comorbidity. As a matter of fact, that's what brings them to Brentwood in the first place. It's just this ability that we've created to be able to also say, oh, this child also has ASD. We need a treatment plan that, just like a special education course in school, that is adapted to take into consideration what are their barriers, what are their needs as we deal with these primary psych issues. How are we also supporting them and making sure that what we're doing is relevant with this secondary diagnosis of autism? That's
what you mentioned earlier, is sometimes they're coming in with this primary diagnosis, but really that root might be that they're not being treated for the ASD in the first place.
That's right.
Okay.
And with mental health across the board, as a community, we need to learn more about autism, but we need to learn more about all neurodivergence and how to be supportive, PTSD, depression, across the board.
Well, this has been so informative, I'm sure, for me, and I'm sure for everyone watching. So if someone wanted to learn more, where can they find more information about ASD and the program at Brentwood?
On the program at Brentwood, they can go to Brentwood's website, and there's information there about how you can, if you have need, call. If you have someone who is struggling and you're not certain if they are ASD or not, go ahead and reach out to our intake department. They can kind of help you decide what's best, and whether they need inpatient treatment or whether they need to be on an ASD unit or a neurotypical unit.
Okay, and that number to call for you is 318-678-7500.
There it is. You did.
Thanks for joining us, and this will be on our website at ktbs.com/podcast.